Hello, this is Patricia Castro. I am a fellow researcher at Hospital de Especialidades del Centro Médico Nacional, Siglo XXI. The work I am going to present is Solomon-Greenwell as the most accurate nomogram for female bladder outlet obstruction. We have nothing to disclose. As an introduction, the diagnosis of bladder outlet obstruction in women has become a challenge for urology. Bladder outlet obstruction results from a lot of etiologies, such as functional or anatomic, and not only the absence of an etiology well identified, but also the lack of a universal agreement in urodynamics has resulted in the development of many definitions for bladder outlet obstruction. So the aim of our study is to compare the different definitions for bladder outlet obstruction and find which one is the most specific and sensitive in order to achieve a more accurate diagnosis. Methods. After the institutional approval, this retrospective study included the urodynamics and clinical data of 79 women already diagnosed with voiding dysfunction. So we categorized these studies as obstructed or unobstructed based on these definitions. So the control group consisted of women who had been categorized as obstructed with at least 3 different definitions of bladder outlet obstruction. We then compared the control group with every definition of bladder outlet obstruction and estimated the variance components with the maximum likelihood positive ratio. And we consider significant this as p-values less than 0.05. Here in this table of the results, you can see the likelihood positive ratio, the sensitivity, and the specificity for each definition. So from a total of 79 women, 50 were categorized as obstructed and 29 as unobstructed. The comparison between our control group and every definition of bladder outlet obstruction has shown a statistically significant difference. So as you can see here, the Solomon-Greenwell has shown to be more specific and sensitive, and also it has the highest likelihood positive ratio. Here, the lowest positive ratio was here for Farrar, and also shows a sensitivity of 12% and a specificity of 100%. So this Solomon-Greenwell for us was sensitive, specific, and with the highest likelihood positive ratio. So the urodynamic assessment of voiding provides critical data for workup and management for patients with bladder outlet obstruction. Nevertheless, there are a lot of definitions. The Solomon-Greenwell nomogram has shown to be the most accurate definition. To sum up, the diagnosis of bladder outlet obstruction requires expertise and individualization of each patient, and it's made through physical examination and complete urodynamic study. Thank you for your attention.